Well, can you see the slide full screen?
No, ma'am.
No, ma'am.
So I need to do it like, Can you see the slide full screen?
Yes, ma'am.
Okay, good. Now, so we've just drawn this table, and now we are going to listen to the doctors, what they say about these patients. Now get started, and you tell me if you can hear the recording.
2.
Oh.
Unit 9. Listening.
Can you hear?
Yes, ma'am.
Unit 9. Listening. 1.
Mr. Jones had the appearance of self-neglect. He did not appear to be paying attention to what was being said. He looked as if he had withdrawn completely from his surroundings and was preoccupied with his own thoughts, with no eye contact whatsoever. He sat hugging himself during the interview. He did not interact much with the nurse, nor look at anyone else. He left me feeling in quite a low mood myself.
2.
Although Miss Rigby is in her late 40s, she wears really bright clothes, which are suitable for someone much younger. When she was admitted, she was in a highly elevated mood, hyperactive, and was awake all night. Her thoughts are all over the place. She did not appear to be aware of anything abnormal in her behaviour.
3.
Mr. Dixon was well dressed, but looked very worried and anxious. He sat on the edge of the chair, was quite agitated, and couldn't sit still. He was fidgeting all the time and had very poor concentration, though he looked at me when he spoke and was spoken to. I felt safe with him, but a bit nervous after the interview.
Well, do we need to listen for the second time?
Yes, ma'am.
Yes, now, please.
Unit 9. Listening. 1.
Mr. Jones had the appearance of self-neglect. He did not appear to be paying attention to what was being said. He looked as if he had withdrawn completely from his surroundings and was preoccupied with his own thoughts, with no eye contact whatsoever. He sat hugging himself during the interview. He did not interact much with the nurse, nor look at anyone else. He left me feeling in quite a low mood myself.
2.
Although Miss Rigby is in her late 40s, she wears really bright clothes, which are suitable for someone much younger. When she was admitted, she was in a highly elevated mood, hyperactive, and was awake all night. Her thoughts are all over the place. She did not appear to be aware of anything abnormal in her behaviour.
3.
Mr. Dixon was well dressed, but looked very worried and anxious. He sat on the edge of the chair, was quite agitated, and couldn't sit still. He was fidgeting all the time and had very poor concentration, though he looked at me when he spoke and was spoken to. I felt safe with him, but a bit nervous after the interview.
Well, so how can we describe the behavior of Mr. Jones? So let us listen to Ashwati.
Yes, ma'am. James was having an appearance of self-neglect, and he don't pay attention to the people. He appeared like not paying attention to people, that is the eye contact.
No eye contact. Yes, okay. Mhm.
And the manner he looks was like withdrawn completely, like he
Mhm.
was not much concentrated.
Right. So,
Um, and he was mode of speech.
okay. So, what else can we add? Yes,
He sat hugging,
himself. Yeah. Mm-hmm. Mm-hmm.
and the doctor's feeling was he was in a low mood
In a
after
moment.
seeing.
Yes, you're right. Well, now let us just speak about Miss Rigby, and this is for Taib.
Yes, ma'am.
Mhm.
Telling about her appearance, she wears really bright clothes appearance, and telling about the eye contact, she was
I think there was no information.
hyperactive.
Yes, hyperactive. Okay. Mm-hmm.
Okay, and telling about the manner, she was awake all the night,
Mm-hmm.
and mode of speech. Mm, her
Maybe there was
oh,
there was no information about how she was speaking. What about the insight?
yes,
Did she understand her problem? Was she aware of?
yeah, she was abnormal in her behavior.
Yes, she had abnormal
Has her,
behavior, but she didn't understand this. Yes, that her behavior was abnormal. Okay.
yeah, and she has a highly elevated mood, ma'am.
Yes, you're right. Okay. Well, can we add anything to this description? Uh-huh. What about the way she was dressed?
Her thoughts were all over the place. Her thoughts were all over the place.
Mhm. Okay, good. And now, Mr. Dixon, let us listen to Labib.
Yes, ma'am.
Mhm.
So, Mr. Dixon was well dressed,
Okay.
and also he was very worried and anxious, and also he sat at the edge of the chair, and
Mhm.
also he was very quite agitated, and also he couldn't sit still, and also uh,
Did they have eye contact?
yeah, he was fidgeting all the time, and also he has a very poor concentration.
Mhm. And how did the doctor feel after the meeting?
Doctor feel very safe with him, but a bit nervous
Mhm.
after the interview.
Exactly. Well, thank you. And what is their diagnosis?
Unit 9.
What is likely diagnosis in each case? So, in the first case with Mr. Jones, who was withdrawn, preoccupied with his thoughts, just poorly dressed, like badly dressed, in low mood. Sorry?
No, seems like depression, ma'am, because he is in his own thoughts and hugging himself.
Mhm.
Also, he's self-neglecting himself. So, seems like he's going through depression, ma'am.
Exactly. Mhm. Now, Miss Rigby, how can we describe her behavior? And so, what is the diagnosis? So we were speaking about similar case when people just dressed in bright colors and extravagant just clothes. So just to attract attention. Yes?
Ma'am, is it mania, ma'am? Because she is flamboyant and she is highly active, hyperactive, and she is above all night. She's not in her sense.
Exactly, you're right. So this is mania. And the last person, Mr. Dixon.
Anxiety.
Anxiety, yeah. So this is his diagnosis, anxiety. Okay, good. Now let us just turn to the next step. And now we're going to read about psychotherapist Dr. Tom Turner. And before we start reading, let us have a look at this list of skills that a good psychotherapist should have. And we can see 8 skills described here on this slide, but we should try to predict which 5 skills will be mentioned by Dr. Turner. So please just have a look at the skills and choose the most useful skills in psychotherapist practice. What do you think is important? Yes?
Clearly and carefully.
Speaking clearly and carefully. This one.
Listening to patient.
Listening to patient.
Oh, yes, listening is important. Okay. What else?
Developing the patient's
Developing the
trust.
patient's trust.
Trust. Mm-hmm.
Using sympathy and empathy while talking to the patient.
Yes, okay. Mm-hmm. And one more.
Being a
Being proficient in psychotherapy.
Psychotherapy. Okay, thank you. Now let's check what Dr. Turner says about this. So we're going to read this article and let us listen first to Hepzibah, please.
Yes, ma'am. My name is Dr. Tom Turner, and I have been asked many times why I chose psychiatry. I had chosen a period in A&E, that is accident and emergency, for my next undergraduate rotation when an opportunity to work on psychiatric ward came up, and it seemed like an interesting option. So it wasn't something I had planned for a long time.
Mm-hmm. So he's speaking about his experience and why he started working in psychiatry. Now the next piece of information is for Ansila. Please.
Yes, ma'am. Can you hear me?
Yes, yes, we can hear.
Now I work as a locum psychiatrist, which fits in perfectly with my lifestyle. I have followed a range of courses and training in various areas of psychotherapy, cognitive behavioral therapy, and so on. But the most important skills I think I have learned and that have carried me through these years are those emphasized in my internship by my mentor and which still hold true today.
Mm-hmm. So he's starting speaking about his the essential just skills every psychotherapist should have. And now the next piece of information is for Asna.
Yes, ma'am. First of all, there is a being able to allow time to help in the healing process for the patient, the family, and the doctor. Coming from the hectic life of my previous department, and now I seem to be moving in another dimension. I soon found that impatience was not going to help me or patience, and that the whole process began with the first contact through the discharge from a ward.
Mm-hmm. Okay, so and the last piece of information is for Shamisha here.
Yes, ma'am.
So read it, please.
Listening is another but no less valuable skill I had of course done a lot in my training, but working on the what impressed upon me the effect on the patient of just having someone taking time to listen. And through this came trust. Being non-judgmental as we listen to the patients is another important technique, as otherwise there is a danger of patient alienation. Finally, there is the ability to use our skills of daily living, which can reteach to patients as they prepare for discharge.
So there is a word alienation. What does it mean? Patient alienation. It's like alien behavior, like an alien, right? Isolation, we can say. Okay, so this is the information about the skills, and now let us look at this list of skills one more time and just say what skills were mentioned by Dr. Turner. Did he speak about the first skill, knowing how to use your own one's own daily life skill? Did he mention this skill?
Yes, ma'am. Yes, ma'am.
Yes, like here in the last part, he says there is the ability to use our skill of daily living just after the patient, prepare the patient for discharge. So when the patient leaves out of the hospital, and so the other skills, what are they?
Stopping oneself from making judgments about patient.
Yes. What else?
Developing the patient's trust.
Listening to
Sorry?
the patient.
We'll repeat.
Listening to the patient.
Listening. Yes, trust. You said developing the patient's trust, and also one more skill which is important and which is different from the previous practice when the Dr. Turner was working in A&D. So he says that it's important. Yes.
Letting time run its course.
Yes, letting time run its course. He speaks about being patient and just let this is changing his attitude towards time. Okay, thank you. And now let us focus on some grammar aspects that the doctor, some tenses that the Dr. Turner uses in his speech. So this is the phrase taken from the article. He says, I had chosen a period in A&D for my next undergraduate rotation when an opportunity to work on psychiatric ward came up. So he uses two grammar tenses, the verbs in two grammar forms, so past simple and past perfect. So came up, this is the past simple, and had chosen, this is the past perfect tense. So, and one more example, it wasn't something I had planned for a long time also. No, wasn't is used in the past simple tense form, and had planned, this is the past perfect. So when we use them in one sentence, so we should use past simple and past perfect to describe an event or period which happened before a point or period in the past. Both these tenses are used to speak about the past. But what's the difference? So first of all, there is some information about the form of the past perfect tense. You can see here on this slide that it consists of two parts. So the first part is the auxiliary verb had, and the second part is the past participle of the main verb. So when do we use the past perfect tense? The past perfect takes place before another past action. And the example here, I noticed that he had left his books behind. I noticed that was in the past. but had left. The action happened before I noticed that. So this is like if we show it on the timeline, the past simple shows the action, and the past perfect shows the action which happened earlier, before the other action which is used in the past simple tense. Is it clear?
Yes, ma'am.
Okay. And so here are some expressions that are commonly used in the sentences with the past perfect tense. Like, after I had eaten, I returned to work. So after is the just time marker here. The shift was over by the time I had written up the notes. By the time I had already left the ward when he arrived. So already here. I fell asleep before I had finished studying before now. And once I'd finished washing my hands, I was ready to begin. You see in all these sentences, two verbs are used, and one is in the past simple, the another is in the past perfect, just showing that this action happened before. Now, let us look at this slide, and here we have the practical assignment. We should complete the sentences by putting the verbs in the correct tense. So one of them should be used in the past simple and the other should be used in the past perfect tense. If we have a look at the first sentence about Dr. Glover, so finish his ward rounds when the consultant telephoned. So we should understand which action happened first and before another action. Which was the earliest action, finish or telephone? Yes? Who can answer this question? Finish or telephone?
Finished.
Finish was first. Yes, that is why we should use past finish in the past perfect tense. And you see that already is also used here, which is the mark of the past perfect tense. So it sounds like Dr. Glover
had already
finished his ward rounds when the consultant telephoned. Yes, you're right. So now please look at the other sentences and use the verbs which are given in brackets in the correct form, in the past simple or past perfect tense. So just 3 minutes for you to do this.
already
Well, let us just discuss the sentences here. And Shamisha,
Yes, ma'am.
so the second sentence, please.
The doctor rushed to the ward, but the patient had already disappeared.
So the doctor rushed, but the patient had already disappeared. Okay. So Ranisha, please.
Yes, ma'am. I did some assessment test before, so I had knew what to do.
Look, there is a word before. It shows that do, this verb should be used. It stands for the action which happened first, before. So we should use do in the past perfect tense. So what's the form of the past perfect of do?
Had done. I had done.
Yes, I had done some assessment tests before, so I
knew what to do.
Yes, exactly. Okay. Well, John Parvin, please, the next sentence.
Yes, ma'am. Mrs. Scott has been well known to the police, and they had arrested her once before.
And
once before and brought her to the hospital.
Well, actually, we have three verbs here, but look, so I do not agree with the use of past perfect with the verb to be here in the first sentence. So it's better to use it in the past simple tense. So like Mrs. Scott, the past simple of be. Who can help us? Was, yes, was well known to the police. They had arrested her once and brought or had brought her to the hospital. Okay. Well, the next is for Hala Malik.
Ma'am, fifth one, you made you dash make up you make up your mind about your future career when you be at secondary school. Had you made up your mind about your future career when you were at secondary school?
Exactly, you are right. This is the question, or you should start with the had. Thank you. Now the next is for Sultan.
Yes, ma'am. He had not completed his internship by the time he left his home country.
Yes, exactly. Good. Thanks. And now Sinju.
Yes, ma'am. In 1960, a year after Roche first synthesized diazepam, Roche, along with Merck and Lundbeck, had introduced amitriptyline market.
Yes. All right. Good. Thank you. And now, yes. So now we are going to. Yes, now we are going to read some. We're short of time now. Read some information about how to take psychiatric history. So because it's different from taking patient's history when from the other medical specialists. So this is the description of the way the doctor, psychotherapist should talk to their patients, just to learn something about their conditions. Now let us read this article, and so it's Danish's turn. So Danish, start reading, please.
Eliciting the history. Introduce yourself, explain to the patient how long the interview will take, and explain its purpose. Find out how the patient came to be referred and what his expectations are, for example, about treatment. If the patient denies having any problem or is reluctant to start talking about himself, do not hurry him. Try asking, how are you? What has been happening to you? And what are the most important things? Another approach for hospital patients is to indicate why the GP referred the patient and then ask what the patient thinks about this. Sit back and listen without interrupting. Nothing exact examples of what the patient is saying. Take more control after about 3 minutes to cover the following topics.
Mhm. So these are the steps that follow. We just read about Dr. Psychotherapist Turner, Dr. Turner, and so about just not being in a hurry, about another approach to time. And you can also see that in this description of the steps, the doctor should use the Socrates model that we were speaking previously once. So the next piece of information is for Shwati.
Yes, ma'am. Presenting symptoms. Agreeing a problem list with the patient early and be sure it is comprehensive. Example, by asking if we were able to deal with all these, would things then be all right? Or if I were to help you, how would things be different? Then take each problem in turn and find out about the onset, the duration, the effects on the patient's life and family, events coinciding with the onset, the solutions tried, reasons why they failed. The next step is to inquire about moods and beliefs during the last weeks. This is different from the mental state examination, which refers to the mental state at the time of interview.
Mhm. Okay, and the next piece of information is for Taib.
Yes, ma'am. Specifically check for suicidal thoughts, plans, or actions. The more specific these are, the greater the danger. Discussing suicide does not increase the danger. Depression, low mood, anhedonia, unable to feel pleasure, self-denigration, I am worthless, oh, I wish I had not been born, guilt, it's all my fault, lack of interest in hobbies and friends, plus biological markers of depression, early morning waking, decreased appetite and sexual activity, weight loss, mania, symptoms of psychosis, persecutory beliefs, delusions, hallucinations, drug and alcohol use, obsessional thoughts, anxiety, eating disorders. Example, young woman often not volunteered and important, not compulsive behavior. Example, excessive hand washing.
Mhm. So these are the most common disorders in psychiatry, and so actually we're short of time, and let us focus on what we should do. So after this class, you see that you need to complete the midterm 3 test. And so it's on the Moodle site, and now I'm going to just open to give you access to this test. So, and it consists of 22 questions. And there are 3 types of questions in the test, like true, false. There is a statement and you should decide whether it's true or false, then matching questions. For example, some definitions, and you should just terms, and you should match them with their definitions, or at the beginnings of sentences and the second parts of the sentences. Then select missing words. It means that there are several gaps in the text, and you should just click on the gap, and 3 or 4 options will appear, and you should choose from these options just the place for each word in the text. And so you'll be given an hour. So I'll start now after the class, and but you remember how to deal with this test. So while you just start the test, it will so the time will start, and you are given only 30 minutes, and after this time, half an hour just is over, the test will close automatically. So just you should remember this. And this is just the last